Which ECG lead is most sensitive to detecting ischemia in the inferior wall of the heart? A. Lead I. B. Lead 2. C. Lead AVL. D. Lead V6. Answer, B. Inferior wall ischemia is best detected by leads 2, 3, and AVF. Among them, lead 2 is particularly sensitive due to its axis orientation. What is the primary purpose of a Holter monitor in cardiac testing? A. To detect exercise-induced arrhythmias. B. To continuously monitor heart rhythm for 24 to 48 hours. C. To measure cardiac output during stress. D. To evaluate structural heart disease. Answer, B. A Holter monitor records continuous ECG activity for 24 to 48 hours, allowing detection of intermittent arrhythmias or ST changes that may not appear during routine ECG. In a pediatric ECG, which finding is considered normal compared to adults? A. Tall R waves in V1. B. Shorter QT interval. C. Sinus bradycardia. D. Wide QRS complexes. Answer, A. In children, right ventricular dominance produces taller R waves in V1, which is normal and should not be confused with hypertrophy. During a treadmill stress test, the patient developed chest pain and 2 mm street depression. What is the immediate next step? A. Stop the test immediately. B. Reduce treadmill speed and continue. C. Administer beta blockers. D. Switch to a Holter monitor. Answer, A. Significant ST depression with chest pain is an absolute indication to terminate the exercise stress test for patient safety. Which electrolyte imbalance most commonly leads to peak T waves on ECG? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Answer, B. Hyperkalemia produces tall, peaked T waves, wide QRS complexes, and can progress to life-threatening arrhythmias. In ECG electrode placement, where is lead V4 correctly positioned? A. Fourth intercostal space, left sternal border. B. Fifth intercostal space, midclavicular line. C. Fifth intercostal space, anterior axillary line. D. Sixth intercostal space, midaxillary line. Answer, B. V4 is placed at the fifth intercostal space, midclavicular line, critical for accurate precordial lead placement. Which rhythm is best described as an irregular baseline without identifiable P waves? A. Atrial flutter. B. Atrial fibrillation. C. Ventricular tachycardia. D. Junctional rhythm. Answer, B. Atrial fibrillation is characterized by chaotic baseline activity, absence of P waves, and irregular ventricular response. A patient undergoing stress testing suddenly collapses and shows pulseless ventricular tachycardia. What is the first action? A. Start chest compressions. B. Give 4-lidocaine. C. Apply synchronized cardioversion. D. Begin oxygen therapy. Answer, A. In pulseless VT, CPR is the first step, followed quickly by defibrillation. Which of the following can cause low-voltage QRS complexes on ECG? A. Pericardial effusion. B. Hyperthyroidism. C. Left ventricular hypertrophy. D. Pulmonary embolism. Answer, A. Fluid around the heart, as in pericardial effusion, dampens electrical activity, producing low-voltage QRS complexes. Which wave on the ECG represents atrial depolarization? A. P wave. B. QRS complex. C. T wave. D. U wave. Answer, A. The P wave reflects atrial depolarization, preceding ventricular depolarization shown by QRS. In a normal 12-lead ECG, which leads typically show a positive deflection of the P wave? A. AVR. B. Lead 1 and 2. C. V1 only. D. V5 and V6. Answer, B. The P wave is normally upright in leads 1 and 2 because the depolarization wave moves toward those leads. A patient's QT interval measures 0.52 seconds. What does this suggest? A. Normal finding. B. QT prolongation. C. QT shortening. D. Bundle branch block. Answer, B. A QT interval longer than 0.44 to 0.46 seconds, depending on heart rate, indicates QT prolongation, predisposing to torsades de pointes. What is the correct paper speed for recording a standard ECG in the US? A. 10 mm per second. B. 25 mm per second. C. 50 mm per second. D. 75 mm per second. Answer, B. Standard ECG paper runs at 25 mm per second in the US, ensuring accurate interpretation of intervals and waves. Which condition is suggested by a delta wave on ECG? A. Wolff-Parkinson-White syndrome. B. Atrial flutter. C. Hyperkalemia. D. Pulmonary embolism. Answer, A. The delta wave, a slurred upstroke of the QRS complex, is a hallmark of Wolff-Parkinson-White syndrome due to accessory pathway conduction. What is the primary risk of misplacing precordial leads during ECG recording? A. Prolonged PR interval. B. Misdiagnosis of myocardial infarction. C. Increase in QRS amplitude. D. False bradycardia reading. Answer, B. Incorrect precordial lead placement may mimic or mask myocardial infarction patterns, leading to dangerous misdiagnosis. Which cardiac test provides information about both electrical activity and mechanical function? A. Holter monitor. B. Echocardiogram. C. Standard ECG. D. Signal averaged ECG. Answer, B. Echocardiography evaluates heart structure and mechanical function, while ECG shows only electrical activity. What does a PR interval longer than 0.20 seconds indicate? A. First-degree AV block. B. Normal sinus rhythm. C. Left ventricular hypertrophy. D. Ventricular fibrillation. Answer, A. A PR interval greater than 0.20 seconds is diagnostic of first-degree atrioventricular block. Which patient position is most appropriate for accurate ECG recording? A. Prone position. B. Left lateral decubitus. C. Supine position. D. Sitting upright. Answer, C. The supine position with relaxed arms and legs reduces muscle artifacts and provides accurate ECG readings. Which finding is typical in ventricular fibrillation? A. Wide regular QRS complexes. B. Organized atrial activity. C. Chaotic, irregular waves with no QRS. D. Tall peaked P waves. Answer, C. Ventricular fibrillation shows chaotic, disorganized electrical activity with no recognizable QRS complexes, requiring immediate defibrillation. Which feature best distinguishes atrial flutter from atrial fibrillation? A. Presence of delta waves. B. Flutter waves with sawtooth pattern. C. Wide irregular QRS complexes. D. Consistently irregular baseline. Answer, B. Atrial flutter produces characteristic sawtooth flutter waves, unlike the irregular chaotic baseline in atrial fibrillation. A patient has an RR interval of 20 small boxes on ECG paper. What is their approximate heart rate? A. 150 bpm. B. 120 bpm. C. 75 bpm. D. 60 bpm. Answer, D. At 25 mm per second, each small box is 0.04 seconds. 20 boxes equals 0.8 seconds per beat. 60 divided by 1.0 is almost equal to 60 to 75 bpm, closer to 60 bpm. Which test is most useful for detecting silent myocardial ischemia? A. 12-lead ECG at rest. B. Exercise stress test. C. Echocardiogram. D. cardiac catheterization. Answer, B. Silent ischemia often appears only under stress, making treadmill stress testing the most reliable tool. Which lead is most useful for monitoring atrial activity in arrhythmia patients? A. EVR. B. Lead 2. C. Lead V1. D. Lead 3. Answer, C. Lead V1 closely records atrial activity, including P waves and flutter/fibrillation waves, helpful in arrhythmia diagnosis. Which ECG change is most commonly seen in hypocalcemia? A. Short QT interval. B. Prolonged QT interval. C. Wide QRS complex. D. Tall P waves. Answer, B. Hypocalcemia prolongs the QT interval by extending ventricular repolarization. Which type of artifact is caused by patient shivering during ECG recording? A. Wandering baseline. B. Muscle tremor artifact. C. AC interference. D. Lead reversal artifact. Answer, B. Shivering produces rapid, erratic baseline activity known as muscle tremor artifact, often confused with atrial fibrillation.